We think in the past that everybody could do everything by himself and he didn't have to ask anybody what to do. So that was this one-man show. Nowadays, the specialization has gone so far and is so complex that we think nobody can do the job by himself. So why not split the job and also split the consequences if something happens. The HeartTeam is the optimal way to treat patients if I'm not comfortable with doing something, which I'm not doing every day. So why not have somebody else do that task, what you probably did in the past by yourself? Why not give it to somebody else who is doing it more often? And the HeartTeam, we think, is the best way to treat patients because we can split the task, we can have input from several different angles to get the optimal way of treating cardiac diseases. We started the HeartTeam at the University Hospital at that time when transcatheter valve procedure actually started and were in the early beginning. Roberto Corti, my partner at the cardiology unit in the University Hospital, and myself, we were asked to build this transcatheter-based unit. And we thought it might be an ideal or almost an ideal situation to get cardiology and cardiac surgery together. At the beginning, we were working so close together. We were discussing all the patients together. We were standing in the hybrid OR together. We also thought, why not sharing all the financial reimbursement together, and this was impossible at that time at the University Hospital because cardiology and cardiac surgery were different units and they had different budgets, so we could not get the hybrid OR budget in one unit. So we thought, why not doing this? Or we had the opportunity actually to start the real HeartTeam and a combined unit, cardiology, cardiac surgery at the Hirslanden clinic, and we started the HeartKlinik Zurich in 2013, exactly with this purpose to have cardiology and cardiac surgery combined. We believe that the added value for patients treated in a HeartTeam are especially the unbiased approach to the treatment. If we discuss all the patients in a HeartTeam between cardiology and cardiac surgery, we have the optimal treatment options discussed, and we decide for the best treatment for this individual patient. We strongly believe that if you take out, the financial reimbursement out of the equation, you're not driven by the monetary refund if you want to treat a patient. And that's why we think all patients should be treated after they have been discussed in a HeartTeam. So the best treatment option is available and offered to the patient. Since we have been practicing this HeartTeam approach consistently in our clinic, we were able to reduce the mortality rates or in the outcomes for instance, for aortic valve replacement surgery to almost zero. So that's a benefit for the patient. So we select the patients specifically for one treatment to get the optimal result.